Hi, everybody. My name is Megan Ockett. I'm the program director with Healthy Birthday Count the Kicks. I'm sorry I couldn't be there live today, but I'm excited to at least provide this recording for you so you can learn more about our evidence-based stillbirth prevention campaign. Thanks in partnership to Anthem Medicaid and the Indiana Minority Health Coalition. We're excited to be launched in your great state with this information. So that's why I can do trainings like this and that you'll have access to all this great, wonderful free material. So with that, we'll go ahead and get started. Obviously, like I just introduced myself, my name is Megan. I'm the program director. So Healthy Birthday is a nonprofit organization that created Count the Kicks, which is the evidence-based stillbirth prevention campaign that you'll be learning about over the next 15 minutes. My contact information is on the screen. So if you want additional trainings or have questions, feel free to reach out to me. I love hearing from you all. You're the boots on the ground. You're why this is going to be so successful in your state. We've already heard about a couple baby saves that we know about that happened in Indiana. So I'm just excited to be here today, at least recorded, so that you can learn more about this and start implementing it within your workflow. And so before we dive in, let's talk a little bit about the data, right? So stillbirth is the loss of a baby after 20 weeks of pregnancy. So we're talking about around 23,500 babies every year in the United States are born still. That's 65 babies a day. So if we think about that, that's like a busload of kindergartners or classroom full. And if that happened and we lost a busload of kindergartners every day, we'd be talking about that, right? We'd be talking about that in the media everywhere. We'd be saying, how do we stop this? How do we stop this? So why are we not talking about stillbirth like that, right? Stillbirth is still very taboo. Nobody talks about it. And we understand that, right? It's sad, it's tragic. But until we start talking about it and addressing it, we won't change that number. We won't decrease that. So that's what we're going to do today, kind of give you the knowledge, the tools and resources to be more comfortable talking about stillbirth and stillbirth prevention, but also the tools and resources for expectant parents to be able to understand the importance of fetal movement monitoring. So nationally, 1 in 169 pregnancies ends in stillbirth, and the racial disparities are huge. Black women, it's 1 in 96. Black women are 2 times, sometimes 3 times more likely to experience a stillbirth over their white counterpart. Hispanic moms, 1 in 199 pregnancies. Indigenous, 1 in 138. White women, 1 in 204. Asian Pacific Islanders, 1 in 233. Again, this is just as prevalent as infant mortality. We lose 22,000 babies every day, every year to infant mortality. And again, stillbirth is 23,500. So where families are 10 times more likely to lose a baby to stillbirth than to SIDS. Let's take a little bit closer look at your data specifically in Indiana. So based on the most recent 5-year average, the stillbirth rate in Indiana is 6.01 fetal deaths per 1,000 live births. So if you look at that graph there, you'll see the US rate there in teal, your Indiana is red, and then yellow is Iowa, because what we want to do is get your stillbirth rate down to where Iowa is or even further, right? We've seen a 32% reduction in the number of stillbirths in Iowa. That's what we want to bring to Indiana. And I'll talk about that in a second. So on average, Indiana loses around 502 babies every year due to stillbirth. If we were to replicate Count the Kicks like we've done in Iowa and Indiana, and if we see a 32% reduction in Indiana like we've done in Iowa, we have the potential of saving 161 Indiana babies from preventable stillbirth. So that's what we're hoping to accomplish. So when I talk about that 32% reduction that we've seen in Iowa, this is it in graph form. So Count the Kicks was actually created and founded in 2008 by 5 Central Iowa women. I'll talk about them in a minute, but they worked with researchers and evidence and created this bright, colorful, empowering campaign. And so from 2008 to 2018, we saw about a 32% reduction in the number of stillbirths here in Iowa. In the first 5 years of the campaign, we saw a 39% reduction at stillbirths among African-American women. And so you can see what we're really paying attention to on this is that dashed line, that downward trend of the stillbirth rate. We know there's some outliers out there, those years that maybe there's a syphilis outbreak, a pandemic, things beyond our control that can greatly impact the stillbirth rate. So what we're really focused on is that downward trend, and public health officials have stated here that there really wasn't anything else going on in Iowa that would have made such an impact on the stillbirth rate. It's not like every expectant parent got doula care, which we know would be tremendous on birth outcomes, or it's not like obesity decreased. In fact, that's increased. So while all these other confounders are increasing, we're still decreasing our stillbirth rate. So this is what we want to bring to Indiana. So just spend a couple minutes here talking about the research and evidence behind this campaign. We have a whole page dedicated to the evidence behind Count the Kicks. So fetal movement monitoring, kick counting has been around for a long time, right? But the tools and resources for you as providers to be able to talk about it with your patients easily and understandably for patients, and the tools and resources for patients to be able to understand what's normal for their baby, when to speak up and how to speak up, that hasn't been created. So that's what the founders created in 2008, along with the help from Iowa Department of Public Health and looking at other research. So this specific journal article on your screen is the one that I shine a light on, because this is the one that really started it all. The founders were at a public health conference when they heard some researchers out of Norway talk about a study that they had done, where when women were educated on the importance of tracking fetal movement in the third trimester, that the stillbirth rate went down around 30% among this cohort of women. And so fast forward, the founders heard this and they came back to Iowa and they said, we can do that. We can create a kick counting campaign that's evidence-based and research-backed, and provide the tools and resources. And so that's what they did in 2008. So this study here, it's on our evidence page. You can read all about it. But Dr. Bruce Fretz, she was the only United States, US researcher on this Norway study. And she's also part of our medical advisory board now. And she says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks, and to speak up if they notice a change. So that normal movement pattern is what's really going to be important, that we're going to talk about here in just a minute. I think my other top question that I get a lot of times during presentations is, wait a second, this is just going to increase anxiety, right? I'm just going to get all these calls. My nurses are going to be running around like crazy. And so I think as humans, we kind of think that, what's that worst case scenario type thing? And I'm here to tell you that that doesn't happen, right? Kick counting does not increase anxiety in most pregnant women. This research study here found that one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true, and that usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. We've also done our own study of our thousands of app users through the Des Moines University and the Harkin Institute, and found that 84% of app users stated that regular tracking was associated with feelings of bonding, including others, spending that time once a day focused on baby, and 77% of app users reported feeling less anxious. The researchers also found and stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, that preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. And I think there's added benefits we don't always think about, right? Reduction of preterm birth rate, fetal growth restrictions identified earlier. Remember, this is just a check on baby. It's a way baby's communicating with the expectant parent. So when somebody comes in with a change in their baby's movements, it's not an automatic delivery, right? There's checks, and you go through NSTs and biophysicals, and just to make sure nothing else is going on, is something going on with mom. Because we also know that women who have stillbirths are a substantially higher risk for severe maternal morbidity than women who have live births. So this quote here from a researcher says, due to the low costs and potential benefits, it's recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So really briefly, I just talked about the connection between stillbirth and maternal morbidity and mortality. We released a white paper earlier this year on this connection. So scan the QR code, feel free to review it. It's on our website in our evidence page. But I think that connections, we know that that's there. So not only do we have the potential to empower and save baby's life if baby's in danger and their movement's changing and needs to be checked out, but also potentially mom's life as well. So again, what is Count the Kicks? We're an evidence-based stillbirth prevention public health campaign. We're an early warning system for expectant parents. We're educating expectant parents on the importance of tracking fetal movement through the use of our mobile app or paper charts. We're empowering expectant parents to speak up to you, their provider, if there's a concern. And 1 in 3 at-risk babies can be saved with Count the Kicks. So you all know this. We want people to start counting in their 3rd trimester, so right at 28 weeks, or 26 weeks if they're considered high risk. This is when research indicates that baby has really established that consistent pattern that parents can feel and track. So when you're talking to expectant parents about this, you're going to talk about how it's more than just a kick, right? It's a roll, it's a jab, it's a push, anything except hiccups, because hiccups are involuntary, as you know, and they do not count towards the fetal movement monitoring. So now in my presentation, this is the part where I say, I'd love for you to multitask, and I'd love for you to take out your phone and download the app. Go into your app store, search Count the Kicks, and download the little yellow clock icon. So you can use it. You can see how easy it is to use and understand it. You can pull out your phone when you're talking to patients and expectant parents and say, look how easy this is. I want you to set this up. I want you to do this daily, and I want to see your data. So how it works is when they're ready to start counting in the 3rd trimester, I cannot highlight this enough. You want to encourage them to do this daily around the same time every day, because what's going to happen is the app helps give them the average amount of time it takes baby to get to 10 movements. And so if they do it daily, they'll start to understand during that time how baby's moving. And so what they do is they find that time, they pick a time every day. They can set up daily reminders in the app so they never forget. They don't have to go into their own calendar. When they're ready to start counting, they just hit that big red button, start counting, and then they see that little teal foot. And when they're sitting down, they're focused on baby and they feel a movement and they want to start with that movement, they tap that footprint and a timer will start. So after that, every time they feel a movement, they tap that footprint again, all the way until they get to 10 movements. When they get to 10 movements, the timer will stop and they'll see that screen that says almost done. Please fill out the following fields to finalize your kick session. So what research also indicates is not only should we be paying attention to how long it takes baby to get to 10 movements, but the strength of those movements. And so what we've done is we worked with researchers and our providers and created a way to track the strength. So after they're done counting, they get asked to rate the strength in that session. How were baby's movements? Were they, strong and fierce, where you kind of felt like limbs poking out, or were they light, hard to feel? We really just don't want that strength to decrease, right? So this is what they're going to monitor here. So they fill it out. After a couple days, what's really cool about the app is you can see in that top picture there, that graph, that line graph, that's what they're going to see after a couple of sessions. They're going to see the average amount of time it takes baby to get to 10 movements, as well as the strength in a bar graph. So that way it's very visual, right? To show them, okay, for this example, my baby takes around 15, 16, 17 minutes to get to 10 movements. Let's say I'm counting one day and it takes, I don't know, an hour and 15 minutes. What happens is that graph changes and it shoots up, indicating to me as the app user to say, that's not my baby's normal movement pattern. I'm going to call my provider and work with them and see what they want me to do. Most likely, hopefully, they're going to want you to come in to get checked out, right? So that's what you'd follow next with what's your protocol when somebody calls with reduced fetal movement or a change in fetal movement. Have them come in, check them out, make sure them and baby's doing okay. So a couple other features. This is in 14 languages. We'll be adding a couple new languages here in the next couple months, Hebrew and Portuguese. It's completely free. There are no ads. You can set daily reminder. You can restart a session or delete a kick. You can download your kick counting history to share with their provider. So that's really important to share with your patients. You can count for single babies or twins. You can manage multiple devices. There's that strength and notes tracking so they can remember certain things about their session and share it with you as a provider. It's just a really great tool to have on hand that makes it so much easier for expectant parents to understand and monitor their baby's movements and to speak up. So it's all about you encouraging them to use this daily and then encouraging them to reach out if they have questions or concerns. We also have this feature on our app that I wanted to highlight today where people could find free or reduced cost services in Indiana. So this is an example in Iowa where I'm from, but all they do is go to the resources section in the app and search. There's this find help resource, and they can put in their zip code, and then they can search for food assistance, childcare assistance, doula care, free and reduced cost services. So if we can connect people prenatally to resources that they need before baby's born, so they don't have to worry about food, assistance or childcare assistance, when that happens and they have a 2-week-old or a 3-week-old. If we can address that head on prenatally, the chance of that baby experiencing adverse childhood experiences can decrease dramatically. So that's just another resource I wanted to share. A couple other great resources that I wanted to share is that we have free print materials for you. So you can scan this QR code. Normally what I do is I play a song and let you go do that right now while I'm talking, and then enter you into a gift card giveaway. But since this is recorded, I still highly encourage you to take a moment together while you're listening to me. Go order to countthe.kicks.org, click on order materials in Indiana. And all of these resources, so posters, brochures, app reminder cards, are available for free for you in English and Spanish. So take advantage of that. Put them in your waiting rooms, put them in your bathrooms, take them in your car when you're driving around, and drop them off at the library. We have libraries order these. The more touch points, the better with this campaign. So that's what I highly encourage you to do. And then we have an online free CE training. It's 2.2 CEs. So you can take this training, just use the code SAVEBABIES-IN for Indiana. And you can access it for free and get credit for it. So a lot more detail than what I'm unfortunately able to give you today. And then this is what I always love to end on, one of our baby saves. So a lot of times expectant parents will contact us and say, I was educated about your app, I was using it, I noticed a change in my baby's fetal movement, I went in and baby's here because of it, thank you. So we call them our baby saves. We have one in Indiana that we just learned about, thanks to amazing providers and outreach that you are already doing. This is an Iowa one. We have her video, so that's why I wanted to share it today. But go check out our Baby Save database, and share those stories, right? Because this is what you're going to remember today. You're going to remember why we do this, and it's because of babies like Nala. So let's watch her story.
She came back in after she had me put on the monitor and stuff, and she's like, we're just going to take her. And I'm like, what? And she's like, her heart rate is dropping every time you have a contraction. I was already scared, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, That was what I lived for, just because I wanted her to, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, what if? Definitely to pay attention to count the kicks, I feel like it's important just because had I not, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, because your baby might not be here. You just pay attention, seriously, like it's your baby's life.
So that's her story. I'm sorry this was so short and quick, but just really thank you for the opportunity to take 20 minutes of your day and your scheduled meeting. I'm sorry I couldn't be there in person. We're an hour behind, so I was probably getting the kids ready for school while you're watching this. Um, Feel free to reach out if you'd like a longer presentation at a different time. We have statewide presentations all the time, so I'll be sure to stay in touch. But with that, I will let you go. And thanks so much for all that you do in your great state.